What if I told you that the burning, the itching, the dryness that wakes you up at night or makes you dread getting into bed could be addressed in exactly 60 seconds, every single night, with nothing complicated and nothing expensive? I know that sounds almost too simple to be real, especially if you have already tried creams, gels, and lubricants that promised relief and quietly failed you. Stay with me for the next few minutes, because today I am giving you the exact routine, down to the second that I give my own patients, and I am going to explain precisely why it works when so many other things have not. I am Dr. William Harrison, and I have specialized in women's intimate health after menopause for more than 20 years. Before we go any further, I want you to hear something clearly. If you are lying awake right now because of burning or irritation, or if you have started avoiding tight clothing, certain movements, or even intimacy itself because of this discomfort, none of that means your body failed you. It means nobody ever gave you a routine simple enough to actually stick with, and today that changes. If this is something you are dealing with right now, write "I need this" in the comments below. I read every single one, and I promise you, you will be far from alone. And if you want clear, judgment-free guidance like this delivered every week, subscribe now so you do not miss what is coming next. Let me tell you about Eleanor. Eleanor is 64 years old, and when she came to my clinic, she had a drawer full of products, at least 6 different creams and lubricants she had purchased over 2 years, each one used for a week or two before being abandoned, either because it stung, because it felt sticky, or simply because she forgot to use it consistently. "Doctor," she told me, "I know I'm supposed to be doing something every night, but by the time I get into bed I'm exhausted, and most of these products take so much effort I just give up." That sentence is the reason I built the routine I am about to give you. Eleanor did not need more products. She needed one routine, simple enough that exhaustion would never be a valid excuse to skip it. 4 weeks after starting exactly what I am about to show you, she told me the nighttime burning that had kept her awake for months had essentially disappeared, and she had not added anything else. No new prescriptions, no new appointments, just 60 seconds before sleep. Let's briefly cover why this happens, because understanding the mechanism is what makes the routine actually make sense, rather than feeling like another random instruction to follow blindly. After menopause, estrogen, the hormone responsible for keeping vaginal tissue thick, elastic, and naturally lubricated, drops significantly. The tissue thins, becomes more fragile, and loses much of its natural ability to retain moisture. Think of healthy tissue like a sponge that holds water easily, and postmenopausal tissue like a sponge that has dried out and stiffened, no longer absorbing or holding moisture the way it once did. You cannot simply pour water on a dried-out sponge once and expect it to stay soft. It needs consistent, gentle reintroduction of moisture over time, and that consistency is exactly where most women's routines quietly collapse. There is a second piece of this mechanism that almost never gets explained, and it matters just as much as the hormonal change itself. As tissue thins and dries, the surface becomes more vulnerable to micro-tears, friction, and inflammation from completely ordinary daily activities, walking, sitting, even certain fabrics. Each small irritation triggers a mild inflammatory response, and chronic low-grade inflammation actually interferes with the tissue's ability to retain whatever moisture it does receive, creating a frustrating cycle where dryness causes irritation, irritation causes inflammation, and inflammation worsens the original dryness. This is precisely why a one-time application of any product rarely produces lasting results. You are not just rehydrating tissue, you are interrupting an ongoing inflammatory cycle, and that requires the kind of nightly consistency we are about to walk through, not an occasional, inconsistent effort. Here is the problem with almost every approach I see women try before they come to me. They are either too complicated, requiring multiple steps, multiple products, and several minutes they genuinely do not have the energy for at the end of an exhausting day, or they are too inconsistent, applied only when discomfort is already severe, rather than nightly as genuine maintenance. Both approaches fail for the same underlying reason. They are not designed around how tired, busy, real women actually behave at 10 o'clock at night. A routine that takes 8 or 10 minutes might work beautifully in theory, but if you only manage it 3 nights a week because exhaustion wins the other 4, the tissue never gets the consistent reintroduction of moisture it needs to actually recover. This is exactly why I designed this routine to take precisely 60 seconds, no more and no less. And I want to explain why that specific number matters, because it is not arbitrary. Anything longer, and adherence drops dramatically within the first 2 weeks. I have watched this happen with patient after patient. Anything shorter, and you simply cannot complete the 2 physiological steps your tissue actually needs each night. 60 seconds is the precise threshold where the routine is short enough that exhaustion is never a valid excuse, but long enough to genuinely support tissue repair. Let me walk you through exactly what happens in those 60 seconds. Seconds 0 to 15. Cleanse gently with lukewarm water only. No soap, no cleanser, nothing scented. This step exists because many women unknowingly worsen their dryness every single night by using a scented soap or body wash on already fragile tissue, which strips away what little natural protective barrier remains. Lukewarm water alone is sufficient, and pat the area dry gently rather than rubbing, because friction on thinned tissue creates micro-irritation that compounds over time. Seconds 15 to 40. Apply a pea-sized amount of a fragrance-free vaginal moisturizer, not a lubricant, to the external tissue and just inside the vaginal opening, using clean fingers in slow, gentle strokes rather than rushed dabbing. I specifically recommend a moisturizer containing hyaluronic acid, because this ingredient can hold up to 1,000 times its weight in water, meaning a tiny amount delivers significant, lasting hydration directly to the tissue that needs it most. This 25-second window is the actual therapeutic core of the entire routine, the moment where moisture is genuinely reintroduced to dried, thinned tissue night after night, building cumulative improvement rather than temporary relief. Seconds 40 to 60. This final step is the one almost every woman skips entirely, and it is the reason so many products underperform even when the product itself is good. Allow the area to remain undressed, with no underwear yet, for these final 20 seconds, simply lying back and letting the moisturizer fully absorb before adding any fabric barrier. Putting on underwear immediately wicks away a meaningful portion of the product before it has time to absorb into the tissue itself, essentially wasting a portion of every application without you ever realizing it. These final 20 seconds of patience are quite literally where a significant percentage of the product's effectiveness either gets preserved or gets lost. That is the entire routine, 60 seconds, 3 steps, every single night, ideally right before getting into bed since overnight hours give the tissue extended, undisturbed time to absorb and repair without friction from movement or clothing. I want to address a few things that commonly derail this routine before it has a chance to work. First, do not switch products frequently. I see women cycle through 5 different moisturizers in 2 months, never giving any single one the 2 to 3 weeks it genuinely needs to show measurable improvement, then concluding that nothing works when in reality nothing was given enough time to work. Choose one fragrance-free, hyaluronic acid-based moisturizer and commit to it nightly for a minimum of 3 weeks before evaluating whether it is helping. Second, avoid any product containing glycerin, parabens, or alcohol, all of which can irritate already sensitive tissue and, in some cases, actively worsen the dryness you are trying to treat. Third, this nightly moisturizing routine is separate from anything you use specifically during intimacy. A lubricant used in the moment and a moisturizer used nightly serve 2 completely different physiological purposes, and using only one in place of the other is one of the most common reasons women feel like they are doing everything right, yet seeing no improvement. Let me give you a realistic timeline, because I never want you to expect more than what is genuinely typical. In the first 3 to 5 nights, most women notice the immediate surface-level burning and irritation easing simply from removing scented soap and switching to gentle cleansing, often before the moisturizer itself has even had time to build cumulative effect. By the end of week 2, the nightly hydration begins compounding, and many women report falling asleep without the nagging awareness of discomfort that previously kept them half awake. By week 3 to 4, tissue elasticity itself begins improving measurably, which is when Eleanor told me her nighttime burning had essentially disappeared. By week 6 to 8, most women describe the tissue feeling fundamentally different than it did before they started. Softer, more resilient, and considerably less reactive to friction from clothing or daily movement. I do want to flag a few situations where this routine alone is not enough, and seeing your doctor becomes important rather than optional. If you notice any bleeding that is not related to your menstrual history, any persistent foul odor, any discharge that looks unusual in color or consistency, or if burning and irritation do not improve at all after 3 to 4 full weeks of consistent nightly use, these can sometimes signal an infection or another condition that needs direct medical evaluation rather than home care alone. For the significant majority of postmenopausal dryness, though, this simple nightly routine is genuinely sufficient on its own. Let me also answer a few questions I hear from almost every patient I walk through this routine with. Can I do this routine in the morning instead, if nighttime genuinely does not work for my schedule? Nighttime is preferable because your body remains undisturbed for hours afterward, allowing maximum absorption. But a consistent morning routine is still far better than an inconsistent nighttime one. So choose whichever time you will genuinely do every single day without exception. Do I still need this routine on nights I do not plan on any intimacy at all? Yes, and this is one of the most common misunderstandings I encounter. This routine is daily tissue maintenance, completely separate from intimacy, the same way you moisturize your face nightly regardless of whether anyone will see you the next day. Will this interfere with any vaginal estrogen cream my doctor has already prescribed? No. The two work well together. The moisturizer simply maintains surface hydration between estrogen applications, and most of my patients on prescription therapy continue this nightly routine as a complementary habit rather than a replacement for anything their doctor has recommended. Here is exactly what I want you to do tonight, not next week, tonight. Step 1. Go to your bathroom cabinet right now and remove any scented soap or body wash from your nightly routine entirely. Step 2. If you do not already own a fragrance-free hyaluronic acid-based vaginal moisturizer, that is your one purchase to make this week and only this week, resist buying anything else alongside it. Step 3. Set a quiet phone reminder for whatever time you typically get into bed, labeled simply 60 seconds, because the first few nights are the ones most likely to be forgotten before the habit fully sets in. Step 4. Commit to this exact routine for a minimum of 3 weeks before judging whether it is working, because that is genuinely the minimum window required for tissue to show measurable change. If this video gave you a routine simple enough that you can actually imagine yourself doing it tonight, that is exactly the point, and I would genuinely appreciate you sharing it with a friend who has quietly given up on every complicated routine she has tried before this one. So many women own that same drawer full of abandoned products Eleanor had, each one a small reminder of another attempt that did not stick, and the simplest gift you can give a friend in that position is permission to stop overcomplicating something that was never meant to be complicated in the first place. Leave a comment telling me how many nights in a row you manage this week, because accountability genuinely helps, and I read every single comment personally. Subscribe to this channel and turn on notifications, because every week I share simple, medically grounded routines exactly like this one for women navigating intimate health after 60. I will leave you with this. You do not need 8 steps, you do not need a drawer full of products, and you certainly do not need to keep suffering in silence through another uncomfortable night. You need 60 seconds, done consistently, and tissue that has felt dry and irritated for months can genuinely begin to feel different again. I am Dr. William Harrison, and I will see you in the next video.